HTLV1, the human T-cell leukemia virus. Before I begin, I'd like to point out that HTLV1 and ATLL are two separate diseases. HTLV causes ATLL, or the adult T-cell leukemia lymphoma disease, but ATLL is not the same as HTLV1. The difference between leukemia and lymphoma are seen in where the cancer is. Leukemia is the cancer of the blood-forming tissues, and lymphoma is a cancer in your lymphatic system. HTLV alone has no symptoms, but ATLL does affect the circulatory, skeletal, integumentary, immune, and lymphatic systems. HTLL affects the circulatory system by affecting the T lymphocytes in the blood, which are a type of blood cells. HTLV then turns this RNA into DNA in the cells and incorporates this new DNA into the host's genes. In the circulatory system, adult T-cell leukemia and lymphoma, ATLL, heightens calcium levels, causing weakened bones and kidney stones. It affects the skeletal system by causing bone lesions, we can see here. They weaken the bone, and it affects the integumentary system by causing skin lesions, which we can see every day, such as acne and eczema. However, ATLL skin lesions are more clusters of ATLL cells. It affects the immune and lymphatic systems by enlarging the lymph nodes, which, when left untreated, can lead to pus collections and bacterial infections in the blood. This disease starts by transferring into a cell through cell-to-cell contact, creating DNA from RNA, and then again binding it to the DNA using this infected cell clones with help from the RNA of HBZ, which is a type of hemoglobin that promotes cell growth. This HTLV1 infected cell can eventually develop into an ATLL infected cell. HTLV1 is an infectious disease with an incubation period of about 20 to 60 years, spreading through these cloning cells. Its prodromal period doesn't matter very much for the 95% of cases that never exhibit symptoms, but if it develops into ATLL, it can develop into two types: acute, where the prodromal period is under a year, or smoldering, which is chronic ATL, and it can last to 20 to 40 years. Symptoms include fatigue, thirst, nausea, and vomiting. The clinical period for HTLV1 usually begins by screening for blood if somebody's trying to donate their blood, and they can tell that you have HTLV by seeing antibodies to that particular virus in your blood, or maybe research after a family member developed ATLL, as this disease does tend to stay in families. ATLL symptoms are more prevalent because they actually have symptoms, and the symptoms include skin and bone lesions, swollen liver, spleen, and swollen lymph nodes, and the life expectancy after diagnosis is a mere 6 months to 2 years. However, it is good that HTLV1 is not easy to transmit. It stays within families and regions for long periods of time, and it's not transmissible by casual contact. It is transmissible through sexual contact, breastfeeding from mother to child, and blood, especially transfusions, which is why you have to get your blood checked before you can donate blood, and contaminated needles. This method of transmission is mostly prevalent between drug users. HTLV1 was discovered in America by John Minna and Adi Gadzar in 1979. It was the first retrovirus to be discovered because we believe that human retroviruses didn't exist because we couldn't find them in humans, but we could easily find them in primates and other animals, as well as technical difficulties which hampered efforts to grow human cells in the laboratory. A meeting in March of 1981 led to the realization that Dr. Yori Hanuma of Japan had 2 years earlier discovered the same exact virus. This discovery was the precursor to the ATLL discovery in 1977 in Japan by a group of Japanese doctors. HTLV1 is mostly prevalent in equatorial regions such as West and South Africa, Japan, Oceania, South Asia, and a bit of South America, and mainly the Caribbean, where a British doctor discovered that it was immigrants from this areas to more northern countries that spread HTLV-1. He and a French doctor later did research to find that whether or not somebody had HTLV-1 depended on a particular African tribe from which they descended. HTLV-1 is also mostly prevalent in people aged 30 to 60. The treatment for HTLV-1 is non-existent because there isn't one that exists and none is needed for the 95% that doesn't exhibit symptoms. However, for ATLL, if it's acute, patients are treated with antiviral drugs, chemotherapy, and if they experience temporary recovery, a bone marrow transplant. If the ATLL is chronic, they monitor the disease without any treatment until the treatment is needed. If the cancer comes back, patients go through more rounds of chemotherapy. In 1995, the CDC started the screening process of blood donors in order to help track the disease and decrease its prevalence, as well as determine some guidelines to decrease the spread of HTLV-1 and therefore decrease the spread of ATLL. This has partially worked, as we can see in a 10-year span from the year 2000 to 2010. We can see a general decrease in the estimated population of those with HTLV-1 per year.